Hello, everyone, and thank you for being here today. As future or current dental hygienists, we all share a common goal, and that is to provide the best possible care for our clients, rooted in prevention, education, and compassion. Today, we want to bring attention to something that's often overlooked in our profession, but has the potential to make a major impact on oral and overall health, and that topic is orofacial myofunctional therapy, or OMT. Despite its relevance to our daily assessments, like observing facial symmetry, tongue posture, breathing patterns, and jaw function, OMT is rarely integrated into formal dental hygiene education. This presentation will explore why OMT deserves a more prominent place in our curriculum and profession, who is affected by this gap, and how we can be a part of the change to ensure our clients have access to comprehensive life-enhancing care. Oromyofunctional disorders, or OMDs, are conditions that involve poor coordination or function of the muscles in the face, mouth, and tongue. These disorders can have a major impact on both oral and overall health, yet they often go unrecognized. Clients may experience symptoms like TMJ pain, chronic mouth breathing, poor posture, or even sleep-related issues such as snoring. Myofunctional therapy, or OMT, is a non-invasive and evidence-based treatment approach that uses specific exercises to retrain and strengthen the muscles of the lips, tongue, and face. These exercises help restore proper function, leading to improved breathing, better swallowing patterns, and more stable oral structures. Research shows that OMT can assist in preventing and correcting malocclusion, tongue thrusting, and TMJ disorders, as well as improving orthodontic treatment outcomes. For example, when a client has poor tongue rest posture or a habit of pushing their tongue against their teeth, it can cause the teeth to shift, even after orthodontics. OMT can correct these habits and promote long-term stability. It can also enhance quality of life by reducing symptoms like snoring or chronic mouth breathing. And while OMT is not yet a core part of dental hygiene programs, further education in this area would allow us, as future dental hygienists, to identify dysfunctions early, educate clients, and refer or apply simple exercises within our scope. In short, advocating for OMT means advocating for preventative, patient-centered care and expanding our role in supporting clients beyond basic oral hygiene. As future dental hygienists, we are primary advocates for our clients' overall health, starting with the mouth. Orofacial myofunctional therapy fits naturally with our role, as we already assess soft tissues, observe oral and facial muscle function, and educate clients about habits that impact their health. Integrating OMT into our care allows us to go beyond symptom management and address root causes. OMT aligns with our scope of practice and values by targeting dysfunctions and facial muscles that can affect breathing, speech, posture, and oral development. With OMT, we can help manage or improve TMJ pain, dysfunctional swallowing patterns, airway restrictions and mouth breathing, orthodontic relapse, and improper tongue rest positions. These therapeutic, non-invasive exercise may reduce the need for surgery or long-term treatments, ultimately improving our clients' quality of life across all ages. By embracing OMT, dental hygienists can expand their impact and provide more comprehensive preventative care. As dental hygienists, we follow the dental hygiene process of care, which includes assessment, diagnosis, planning, implementation, and evaluation, also known as ADPI. This structured process helps us identify concerns and tailor care to improve our clients' oral and overall health. During the assessment phase, we gather data by observing how the client breathes, swallows, speaks, and rests their tongue. We also look at facial posture, signs of mouth breathing, or muscle tension in the jaw. These signs may indicate underlying orofacial myofunctional disorders. Next, in the diagnosis stage, we interpret our findings and determine if a dysfunction is present, such as tongue thrust, mouth breathing, or TMJ issues. These conditions often go unnoticed, but they can significantly impact the client's health and quality of life if left unaddressed. In the planning and implementation phases, we can design personalized care strategies. This may include introducing basic myofunctional exercises, providing education to clients, or referring them to trained professionals who can offer advanced OMT programs. This step is crucial in empowering clients to take an active role in improving their muscle function. Finally, in the evaluation phase, we monitor the client's progress and determine if symptoms have improved or resolved. We may also adjust the plan to ensure long-term success and prevent recurrence of the dysfunction. By applying OMT within the ADPI framework and advocating for its inclusion in client care, we address the root causes and not just symptoms, and support lasting oral health improvements and empower ourselves to better serve our clients and elevate our profession. As future RDHs, our ability to recognize these issues and educate others about OMT makes a meaningful impact on both individual and public health outcomes.
Currently, Ontario dental hygiene programs do not formally include education on orofacial myofunctional therapy, or OMT. This leaves future dental hygienists without the necessary training to recognize or manage orofacial myofunctional disorders. OMT certification or education programs are available but are typically offered privately. Access to available educational resources is dependent on financial means and awareness, and in some cases requires membership, creating additional barriers for at-risk individuals. Furthermore, there is limited awareness about OMT among dental professionals and the public. Without formal education, many hygienists and oral health providers miss opportunities for early detection and intervention. Likewise, low public understanding of OMT limits patients' ability to seek out or advocate for this type of care. Access to OMT services is also inequitable. Because these therapies are not covered by public health plans or insurance, they remain out of reach for many vulnerable groups, including low-income families, immigrants, indigenous populations, and those living in remote or underserved areas. The combined effect of these barriers means that many clients experience missed early interventions or for conditions such as tongue thrust, mouth breathing, or TMJ dysfunction. Without timely treatment, these disorders can lead to long-term oral health problems, sleep-disordered breathing, malocclusions, and an overall reduced quality of life, further perpetuating health inequities across the populations. Each of these stakeholders plays a crucial role in supporting the integration of OMT into dental hygiene education and practice. Registered dental hygienists are in a unique position to identify orofacial myofunctional disorders during routine assessments. With proper training, they can educate clients and provide timely referrals. Dentists contribute by addressing structural or dental concerns linked to OMDs, while orthodontists see significant benefits from OMT, as it helps stabilize results and prevents relapse after orthodontic treatment. At the center of this model are clients who stand to gain the most from better breathing, sleep, swallowing, and oral function to reduce need for invasive or repeat treatments and overall gain a better quality of life. Finally, government and education regulators hold the power to enact lasting change. By updating curriculum requirements, providing funding or grants for OMT education, and supporting public health initiatives, they can ensure equitable access to this essential care. Together, these stakeholders form an interconnected system where each plays a vital role in advancing comprehensive oral health care. Currently, myofunctional therapy is only briefly mentioned in most dental hygiene programs, if at all. As it stands, registered dental hygienists are required to seek additional education post-graduation to promote OMT services. However, many do not pursue these courses, often due to lack of awareness or the financial and time barriers associated with private certification. By formally incorporating OMT education into dental hygiene programs, we empower hygienists to better recognize and manage conditions like tongue thrust, TMJ dysfunction, and poor oral muscle habits, such as incorrect swallowing or mouth breathing. What makes OMT so valuable is that it is non-invasive and can be both preventative and therapeutic, particularly for young clients where early intervention can make a lifelong difference. This shift would allow hygienists to play a proactive role in improving clients' overall health rather than simply reacting to problems once they progressed. Expanding OMT in education isn't just a professional enhancement, it's a public health opportunity. Our advocacy aims to establish orofacial myofunctional therapy as a recognized and standardized component of dental hygiene care. We believe OMT should not be limited to optional post-grad courses, but should be fully integrated into the dental hygiene curriculum, equipping students with both the knowledge and clinical skills to use it effectively. By including OMT in the assessment, planning, and intervention stages of the dental hygiene process of care, known as ADPI, hygienists will be able to address orofacial myofunctional disorders more holistically. Clients who suffer from parafunctional habits, chronic snoring, tongue thrust, malocclusion, or poor tongue posture will benefit greatly from early intervention using OMT techniques. In some cases, OMT can even reduce the need for future orthodontic or surgical procedures, which can save clients time and money. Ultimately, our goal is to improve long-term health outcomes and quality of life for clients through greater implementation and accessibility of this preventative, non-invasive therapy.
We look at 3 articles for this advocacy topic. The first one focuses on how orofacial myofunctional therapy can help children who have obstructive sleep apnea hypopnea syndrome, also called OSAHS, affect how children breathe during sleep. It can cause slurring, tiredness, and even change how their face grows. Many of these children have weak mouth and facial muscles. OMT is a set of simple exercises for tongue, lips, and facial muscles. These exercises help improve breathing, swallowing, and muscle strength. The article shows that OMT may help kids breathe better and support normal facial development. The article is a systematic review that includes multiple studies, providing a strong conclusion on how OMT could improve OSAHS, but it lacks data from long-term results, and it does not explain the role of dental hygienists. This article strongly supports the idea that OMT should be included in dental hygiene program in Ontario. We are advocating for OMT training to become part of the dental hygiene education because the article shows that clear evidence that OMT is an effective early treatment for children with breathing and sleep issues. By identifying those problems early, OMT can help prevent long-term issues with facial development, speech, and overall quality of life. As future dental hygienists, we are in a great position to notice signs of orofacial muscle issues during the assessment stage. With the right training, we can educate families and refer children for proper treatment, making a meaningful impact on their health and development.
Our second article reviews tongue thrust habits and their link to malocclusions, like anterior open bites if left unaddressed. Anterior open bites are when the front teeth are pushed outwards, which can result in the need for orthodontics to correct the bite. It explains how OMT retrains tongue posture, swallowing, and orofacial muscle function, addressing the root cause rather than just the symptoms, unlike appliances such as tongue cribs, which prevent the forces from pushing against the teeth. This article stresses the importance of early recognition and intervention, and suggests OMT can also improve breathing, speech, and oral function, making it a valuable complement to orthodontic care. This article reinforces the value of OMT by clearly explaining tongue thrust causes and the importance of early intervention to prevent malocclusions. Though it lacks strong evidence such as randomized controlled trials and age-specific guidelines for best results, it highlights a gap that calls for more research and not inaction. For dental hygienists, this supports our vital role in early detection, education, and collaboration to improve our patient outcomes.
I'll be reviewing effectiveness of orofacial myofunctional therapy in orthodontic clients. This clinical study focused on how OMT enhances orthodontic outcome by addressing muscle dysfunctions that often contribute to treatment relapse, such as tongue thrusting, open mouth posture, and poor tongue resting position. The study found that when these muscle habits are not corrected, tooth movement is more likely to return after braces or other orthodontic treatments. However, when OMT is incorporated, patients show better tongue posture, stronger orofacial muscle tone, and more stable long-term orthodontic results. These improvements support the role of OMT as a complementary tool in orthodontic care. It helps correct parafunctional habits that may otherwise go unnoticed during traditional dental assessments. Now, looking at the barriers and challenges, OMT is currently offered mostly by specialists, making it inaccessible for many clients, especially in low-resource communities. Another major barrier is that OMT is not formally taught in most dental hygiene programs. Without this training, hygienists may miss or misinterpret signs of orofacial myofunctional disorders. Advocating for curriculum inclusions will strengthen RDH roles in early detection, client education, and holistic care delivery. This article makes a strong case for why dental hygienists need to be equipped with the knowledge to identify and respond to OMDs early. This emphasizes how including OMT in dental hygiene curriculum promotes equity in care, especially in communities that lack access to specialists or can't afford private OMT services. It also supports interprofessional collaboration, allowing dental hygienists to work alongside orthodontists and OMT providers for more effect. By embedding OMT training into our education, RDHs can contribute early interventions, improve long term treatment outcomes, and deliver more comprehensive client centered care. This not only benefits our clients but also reinforces the evolving role of dental hygienists as essential providers in preventative and therapeutic oral health. In conclusion, orofacial myofunctional therapy plays a vital role in identifying and treating the root causes of various oral and facial dysfunctions, many which are often overlooked in traditional care. This current gap in education leaves dental hygienists underprepared and clients undeserved. Without formal training and curriculum integration, access to this non invasive and preventative care remains limited, especially for vulnerable populations. By incorporating OMT into Ontario's dental hygiene program, we can ensure that future registered dental hygienists are equipped to identify, address, and even prevent orofacial myofunctional disorders. We call on educators, regulatory bodies, and fellow professionals to support this shift in practice. Let's give every client the chance to breathe better, speak clearer, sleep deeper, and smile wider with the support of informed, empowered dental hygienists.